Hi, this is Mel from Howzit. Today we are talking all things immigration, life in Canada, and specifically we've got the great privilege of having Deanne from Canada abroad with us again. Welcome, Deanne. It's great having you.
Thanks, Mel.
So it's a different discussion today, one that I think that everybody would find quite interesting. We're talking pregnancy, birth, and support, exactly how different it is, Canada versus, in this case, South Africa. But the experience that you have had two kids in two different countries, and you've seen them all and you've done them all. So it's going to be an interesting chat to kind of hear your experience of what it was like, what worked, what didn't work, and kind of some tips. So maybe we should start by just telling us a bit of background about your that story.
So I'm Canadian and I'm married to a South African. So we lived in South Africa for 8 years. And so fell pregnant and had our first daughter in South Africa. And then we moved back to Canada when she was 2.5. And at that time I was 22 weeks pregnant. So the second baby was born here. So I've been, through pregnancy, delivery in both countries. And, even though I'm Canadian, when we came back to Canada, I hadn't been here for 8 years. So it was almost like being a new immigrant, trying to find a doctor and going through this process. So it was just very interesting to kind of compare everything in the two different countries and to go through that. Because I know a lot of my clients, it was kind of strange. As soon as I got pregnant, all of my clients fell pregnant and were asking questions about this. So it's a very unique situation.
So you're saying that being Canadian doesn't give you extra privileges being in Canada?
Not when you have been abroad for too long. So if you've been out of the country for too many days within a 12-month period, when you come back, I had to go through the 90-day wait period before I went on to government medical again. So I was paying out of pocket for things. You have to find a GP, you have to get referred to a specialist. So whether you're a new permanent resident or a returning Canadian, it's the same.
Oh, okay, that's interesting. So going back to the registration process and getting set up when you just landed here and being 22 weeks pregnant, take us through that process. If you because obviously you land when you're pregnant, and is that any different? How does it look registering? You say you had to do that process all again.
Yeah, so also when I used to live in Canada before I moved, I lived in British Columbia, and we now moved to Ottawa, so Ontario, so also different provinces. So I never had medical here because in Canada it's done by each individual province, so it's not a federal system. So even if you move across provinces, you have to re-register in the new province that you've moved to. So it's, paperwork involved. So when we moved back, basically what happens is from the day you land, there's a 90-day wait period. Some provinces right now have waived it with COVID, but we came last year, so none of that was in place. So basically, you could go and register yourself at any time. That 90 days was counted from the day that you landed in Canada, so not the day that you managed to go and do your paperwork. Because sometimes you don't have everything that you need to get registered right away, because they need an actual official proof of address in your province, which you're not going to have from day one.
Yeah.
So what we found to be useful was, day one, we went and got, what was the first thing we did? I already had my social insurance number. I got my daughter's social insurance number because she didn't have one, and they did put an address on that. We went and got our bank accounts opened, and we just used our Airbnb address, and they put it on that in the credit card statement. So we used that. I went and converted. Well, I had kept my Canadian license, luckily. But my husband, he had to switch his South African license to a Canadian one. So once you do that, they just let you put whatever address you want on the license. So we were able to use that.
Okay, that's great.
So that's a nice little tip. If you need a proof of address, go do your learner's license, because they'll let you put whatever you want on there.
Okay, that's a good one. That's a good one to remember.
Yeah, so when you go to register for the medical, they wanted, a license. So I actually switched mine from a BC to an Ontario one. So I had the updated Ontario license with an address, but they wanted a secondary one and it had to be an original. So not like an e-statement. I had to wait for the bank to mail me a bank statement. So that's why I say it takes some time to get that paperwork. So you might end up registering for the medical 30 days after you land, but at least the 90-day wait period is from the day you landed, not the day you managed to go do your paperwork. but
Exactly.
it's still, you know, I'm 22 weeks pregnant and we didn't have a car. So I'm running around
Trying to sort this all out.
walking days a day from this office to this office, trying to get my documents in order.
So that, and did you have to bring any, talking about the documents, did you have to bring any documents from South Africa to show to your doctors here? Was that, what did that look like?
So you don't have to, but I did. So I made sure that I had my full file because at 22 weeks, I'd already gone through, you know, a lot of blood tests and certain scans. So I wanted to have them with me just in case. So when I did finally get referred to, you know, the OB, they did want me to go through this whole panel of blood work. And I was able to say, well, look, I'd already done these. So they did accept the blood tests that I'd done in South Africa. So it did cut down on a few that I had to do because at that stage I was paying out of pocket. But luckily the blood test here, I was expecting it to be really expensive. I think I had to pay like $35. So it was really cheap. And that was for a whole whack of blood tests. So that was okay. But it was good to have all of that stuff with me. And I'd also had, she kind of summarized with my first pregnancy as well. So they had a really good history to work with. So it did cut down on a lot of, you know, testing that I didn't have to pay for, which was great.
Oh, that's awesome. So could you, when you've been, you had to have, do you need, I think my question would be, do you need a recommend to get to an OB, you need to get to a doctor first, which will refer you. And then, so that's the one question. And the second question would be, do you have to go back all the time to the OB, or does that process differ if there's something, you know, if you just want to have a general checkup, can you go back to your doctor, and do you need to book that appointment with your doctor again? How does that look like?
Yeah, so because it's, you know, the medical system here, the way that it's run, even though at that stage in the beginning I was paying out of pocket, I did phone around to the OBs to see if they would just take me on because I was not on the, you know, government medical. Could I just self-refer myself? And they said, unfortunately, the way that the system works, you have to be referred by just a GP. So we didn't have one yet. The area that we moved to, there was quite a wait list, which is common for your bigger cities, unfortunately. But in Canada, because I'd lived here, I knew that I could just go to a walk-in clinic.
Yeah.
But that was also a bit of a mission to find a true walk-in clinic, because there was a few that said they were a walk-in clinic. And when I got there, they said, well, are you a patient here? I said, well, this is a walk-in clinic. I didn't think you were supposed to be. So after going to about 4 of them, we found an actual walk-in clinic, which means that you can just show up and they treat you. Like there's no, they don't have to see you all the time. Like it's for people that don't have an actual GP. So we went to the walk-in clinic and I think it cost me $85 to see the doctor. And we just explained to him that we just moved back. I had my medical file with me and that we wanted to get referred to the OB. So that was fine. He did ask, you know, did we know where we wanted to give birth? Because there was actually 2 different hospitals close to us. So you kind of could pick which one you wanted. And we just picked the one that was a little bit more known for childbirth, like, you know, special maternity ward, the baby stays in the room with you, like certain things that we had looked at that we wanted. But we didn't know, you know, where the doctors were. So he was actually really good and said, you know, where are you staying? I'll refer you to some good doctors that I know. So that was quite nice. And yeah, he took care of everything. He took my file and he scanned it through to that doctor. And they phoned me the next day and made the appointment and took me on. The good thing to know is, you know, because getting a GP might take a while, but for the specialist, if you're pregnant, they told me like they have to take you on and they will take you on immediately. So there's no worry about waiting to get a specialist.
Oh, that's fantastic. So, and talking about one thing that's quite big in South Africa is the 3D scans and 4D scans, and that's typically not covered by your medical aid, and you have to pay for that out of pocket. How does that look here? Does OHIP cover it? What will they cover? Is there any exceptions to that?
Well, this was the one thing that, you know, me and my husband were saying was very different with Canada and South Africa. So in South Africa, because it's, you know, a private system, every time we went to the doctor, because she has a machine in office, you were getting a scan done. So you were seeing your baby and that was great. In Canada, their rooms don't have, because they've got so many rooms, they don't have a machine in every room. So if you need a scan, you actually get referred to an imaging clinic, which is separate. So at every visit, I didn't get to see the baby, which was very different for me. So only if they really felt that they needed to send you, they would send you to an imaging clinic and then it would be covered. But the things like the 3D scans and the 4D scans, you have to pay out of pocket. But there are private clinics that, you know, if you just want to see your baby because you haven't seen them in a while, you can pay and go get those scans done just for your own peace of mind. And you can get the 3D and the 4D, but it is, you've got to pay for it yourself. It's
Okay.
only if there's a medical reason that they need to send you for the scan, is it going to be covered.
Okay. And is it quite a thing here in Canada to have those things done? Is it the norm for people to do that, or?
I found that it wasn't. Like when we kind of told her that we were always getting scans done, she just kind of looked at us like, well, that's really unnecessary. So for them, that's just very practical. Like, well, that's not necessary. It's a waste of healthcare time and, and effort. So yeah, that's how they see it, I guess.
It's interesting. And so let's talk. When you guys moved over, you were 22 weeks pregnant. What season were you in? How did your clothes look? What is that?
So in South Africa, it was winter, and then we came into summer in Canada. And contrary to what people believe, it is hot as hell here in the summer. And Ottawa was humid. So I was just dying of the heat, you know, extremely pregnant, everything swollen. And luckily, my first pregnancy, I had been pregnant in the summer in South Africa. So I still had, you know, my clothes from the first pregnancy to use. But yeah, it was very strange to go from the nice cool weather and then land and be in extreme heat all of a sudden and having to do all of this walking around. It was challenging.
A different experience, I'm sure.
Yeah, for sure. But it was different.
How would you, I mean, just the practicality of if you're looking at, let's say it was winter, you know, the jackets, you just cover up with the jackets. It's a little bit easier because you are warm inside already with having a little mini oven in, and just kind of covering yourself with a jacket and a good pair of shoes, you're good to go.
Yeah, and the great thing here, which I never really saw in South Africa, so here I found there was a lot more maternity stores to pick from and online shopping because everyone ships here, which was great. So they actually, if you are coming for winter, you can buy, it's a really nice proper winter jacket, but you get an insert for your pregnancy belly. So it zips in, and then you just, when you're not pregnant anymore, you still have the jacket. So you get these inserts that sort of expand your winter jacket.
Man alive, what wouldn't they think about? That's amazing.
Yeah, so you don't have to, you know, be worried that you're not going to use this expensive jacket later on. It's quite nice. They're very equipped for these things.
That's very cool. I have not heard about that.
Yeah.
So in terms of a couple of tips of clothing that you just brought over your clothing and said that was good enough to do that, and then buying a couple of extra things.
Yeah, I did have to buy more because my daughter was born in October, and we had sort of a early cold spell, so it was getting extremely cold. And then, you know, you've got to worry about breastfeeding if you're going to do that after. So I did have to go and buy some more winter type clothing. But like I said, you know, with the online shopping here, Amazon, you can just you don't even have to go to the store. You can just buy online, and it's quite cheap. So I just found there was more available. It was cheaper, and I didn't have to go driving around. I could just order online, it was quite convenient.
Oh, that's amazing. It's just it makes it so much easier if you know that they are shopping. So you don't have to, for the people coming over, you don't have to bring suitcases and suitcases of things. They've got them all here.
Oh yeah, for sure. Yeah.
And that's good. So let's talk around things like doulas and is that a thing in Canada or not really?
Yeah. So doulas are normal here, midwives as well. So it's just your personal preference if you want to have one or not. The doulas, I'm not sure if they are covered under medical. Your midwife can be. Yeah, okay. Because each province, again, like I said, their medical system is different. So some of the provinces, they're more up to speed and covering midwifery as opposed to the traditional. I think the doula you still have to pay for, but I found in South Africa with the doula, I also had to pay. It was just the midwives that they covered some of it. So I found that to be actually similar.
Okay, so there was that, so you can do that.
Yeah, and I've met some people here, they've done home births as well. So you don't have to go to the hospital if you don't want to. You still have that option.
So, and that was in South Africa. You could also have a home birth as well, and they would just send the doctors, but that would be in a private instance, where here the doctors would do the similar situation.
I think the home birth, it's more by the midwife. So if you choose to have a midwife, you have the home birth, and then, you know, the birth gets registered after. And, you know, depending on how everything is, maybe you take the baby to the hospital for a checkup, or, you know, it varies. But usually the home birth is done with the midwife.
Okay, okay. So one of the questions that I specifically have is I could recall from previous experience, I was pregnant in London and then moved to South Africa and had my daughter there. And in London, everybody said, the cesarean versus elective, it was a big natural thing. And, you've got to be, where in South Africa, the norm, not the norm, but people said it was okay if you wanted to have a cesarean section. How's moms and how's hospitals and doctors, how are they towards the natural versus elective? Is it a big thing here? Is it?
Okay, so this was another thing that we saw a huge difference with. So with my first daughter, I did want to have a natural birth. So that was what, I just was wanting to do. And I found that my doctor, she was sort of like, oh no, we're doing a C-section. So she was pushing against what I wanted to push the C-section because it sort of fit her diary.
Yeah,
so I wasn't a huge fan of that. So I actually ended up switching doctors so that I could go for the natural. Ended up with an emergency C-section anyway, but we tried. With Canada, it was okay, well, it's the norm, you're going to have a natural unless there's a medical reason for a C-section. But lately, if you feel that you want the C-section and you kind of sit down with your doctor and explain it, they have started to say, okay, we will do this, but it's not pushed on you. Like, they definitely prefer natural childbirth.
Okay.
With me, because I had the emergency C-section and, I sat down and discussed with her kind of the anxiety with having that happen, that I didn't want to go through that again. We were able to just have a C-section scheduled.
Okay.
But it's assumed you're going to have a natural birth.
Okay. Oh, that's great. Okay. So, that's kind of like what I thought it would be.
Yeah.
And here is water birth. What is that? Is that a thing? Yeah, no.
So I did use a bit of that in my first one in South Africa. So I wanted to have a natural birth, and anyone who's maybe in Gauteng, I went to the Genesis clinic there, which is a really well-known clinic. So they did have, like the tubs and everything, because it really actually does help with your pain a lot. In Canada, if you have a home birth, you could do a water birth, but I didn't find that they had those facilities at the hospital. There was some rooms they said that maybe had a tub, but I think it was very rare to have that. So it's more if you're going to have a home birth that you could have the pool and the water.
Okay. So it's not really that much of a thing,
Yeah. But like I said, even in South Africa, unless you were sort of at that one clinic or doing a home birth, the hospitals didn't have it either. So it's not a typical thing.
Exactly. So moving on to the actual birth. So, can you give your doctors a birth plan and say, this is kind of like how I would want it to go? Or is it, this is the way we're going and that's the way it's going to go?
Yeah. So they were, very good, sat with us, said, okay, like, how do you want this to go? How did you do it your first time around? So they were very willing to listen to what we wanted. So that was nice. And then also, because we were having the C-section, they said, okay, well, typically once the child comes out, we put them on you and you have that attachment. So it wasn't the kind of, we're going to take them and you're not going to see them. So they were very good about, is that what you want? How do you want this to happen? So they were very receptive to that, which was great. So I just found that in both countries, they were open to that. So you could have your birth plan, and obviously sometimes it goes out the window, but you could discuss it with them up front. So
I think for anyone, any moms is going, the birth plan where it's got the candles and the select music, and it's not going to happen. My husband rocked up with a cooler box, and he had every kind of chocolate that you could imagine. I said, but I don't need that. And he said, it's not for me. It's not, it's not for me. It's for him. It's like he needed to go through it. So a birth plan, can go only as far as your patients can go.
It's like birth plan. Just throw it out the window, I think.
Exactly. So how does the process differ once you kind of take us through the labor process? Getting to hospital, can you ask for epidural? Is it something that they give quite easily, or do they kind of want to take you through the natural process?
Yeah, I mean, they pretty much said if you want it, it's your choice. They will, like, once you get to the hospital, they obviously need to check how far along you are. And if you're still within the range, you can get an epidural, no problem. So you just ask for it and they bring them in and they do it. So it's not like you have to fight for that at all. It's definitely something they will give you if you ask for it.
Okay, great. That's and do they give you the public transport? Something that I wondered about. If you are, let's say you're coming to Canada and you don't really have a car, because in certain, especially if you move to Toronto and you live in the city, you don't really need a car. So do you phone a hospital or, or an ambulance? Is that something that they do? Do they come?
Yeah, so I guess it's really going to depend, how the labor comes on, how you feel, how urgent it is. So some people, they just hop on the bus and take it to the hospital because they know, okay, well, my contractions are not too far apart, or, whatever the case is. But if it's an emergency,
I'm having a baby, I'm sure that bus driver is going to go at some speed.
It's going to be like, I'm phoning 911, get off my bus. But no, you can phone an ambulance, and if it's, urgent, like they come, because the paramedic can deliver a baby if they need to, and then they'll transport you to the hospital. So if it's an emergency, just phone 911 and the ambulance will take you. Especially, with the winters here, if the transit is shut down, you've got to phone 911 to get them to come and get you. And if they can't get you there in time, at least, the first responders are actually trained to deliver those babies.
Oh, well, that's the thing, is you've got to think about even the weather is just so different, and where you are, the experience will of course be different to what you used to. So take us through your birth, and can you stay? How long do they ask you? It's around about, in South Africa it was 3 days, right? Is the norm 3?
Yeah. So I've also talked to my friends who've had natural, because I wanted to find out with this. So in both countries, I've heard pretty much, you've had the baby, if you can walk, we're kicking you out. If you've had a natural birth, that's the same in both countries. In South Africa, so I was there for about 3 nights. And then in Canada, Friday, Saturday, I think it was 2 nights that I was there. So it was like a 1 night difference. Okay. But it was, fairly similar. Obviously, so with the first one, because it was at the birthing clinic, my husband was able to stay with us. Like the rooms were equipped for the husband to sleep over as well. In Canada, they did have, chairs that folded out into a bed if the dad did want to sleep there. So they did have the equipment if the other parent wanted to sleep in the room as well with you guys. They weren't expected to go home. So that was nice.
Okay. So, and do they have things like private wards over in Canada?
Yeah, so it's kind of the hospital that I was at. So they have private and semi-private rooms. So before you go in, like you'll do your paperwork, kind of like pre-authorization with the medical system, and you would tell them, I would like a private room. But the thing is, with the government medical, private is not covered. So you'd have to pay a little bit extra per day if you wanted your own private room. And if you have, extra medical, like top-up medical, that could be covered by them, or you might have to pay out of pocket. So that's just one thing to consider. I did opt for the private room because I said, I've got a newborn. I don't need someone else's newborn waking me up too. So if I could get the private room, I'm going to do that. So in both countries, I did manage to have a private room.
Oh, okay. And from what I have heard, the additional expenses are not that crazy.
No, I'm trying to think. I mean, it was under, I'm trying to think here. I think it was $150 a night extra.
Okay. So it's not crazy.
It's not crazy, no.
And as you said, it might be covered by that top-up insurance that you've got. Okay. So here's a very, very interesting question that I'm sure everybody asks is, when your baby is born in Canada, do they automatically get citizenship even though you are not, let's say you're out on a work permit or your permanent residency? How does that?
Yeah, if they're born in Canada, regardless of if you're a visitor, a worker, a student, permanent resident, they're a citizen.
Okay. Well, there we go. Tick in the box right there. Yeah. So if you've got a complicated birth, would that be either with, let's say, you've mentioned that you've had a cesarean section, so it's just easier kind of having a C-section over here. But let's say you have got some complications in your process of your pregnancy. Do they deal with it very differently? I'm sure that they give you a lot of extra care as well.
Yeah, so if you had, because they do explain all of this. So again, the hospital I was This was also something that with the first birth in South Africa, because we chose to have it at a birthing clinic instead of a hospital, they did explain if there was going to be any complications that they were going to have to take my baby on their own without me in an ambulance to the hospital.
Okay.
So that was a bit, freaky for me to think about, okay, if something went wrong, and because we ended up with an emergency C-section, I was a bit panicked, but we were both fine and she got to stay with me. But that she would actually been taken to the hospital without me. In Canada, where I had her, my second daughter, the NICU was all in that hospital. So it was just, she was going to get wheeled down the hall. It wasn't, we were going to end up being separated. So if there was any kind of a emergency or extra care needed, the NICU was right on the same floor. So then you would be right next to them and you weren't going to have to be separated.
Okay, that's great. So they do take care of that. And you obviously, because you mentioned that in the beginning, is you will bring your notes back from if you've had some complications in South Africa for them to have a look and take care of that. So it's advisable to bring whatever you've got, bring that along, even if it's in digital format or whatever, so that they can have a good background on that.
Yeah, so what we did before we left is we, told my doctor that, look, we're not dropping off the face of the planet. We are moving back to Canada now. Can you give me a copy of my full record? So they had it all done up for me, had everything. And then there was one form that they missed. So I just emailed her and they emailed it to me later. So, just make sure your doctor knows what's going on. And they're usually really good about giving you the file. And if you need anything, they can email it. So.
Okay, that's
really good to take it with you, especially if you had any complications at all with the first one, just so that your doctor is aware of that. Because sometimes in that moment, you don't remember everything that happened. So it's good if you actually have the doctor write everything down.
Exactly. So here's an interesting one is, what do you take with when you kind of go into hospital? In South Africa, they used to, at many of the hospitals, you would get like a bag, a care bag with all your stuff in. Do they have something like that in Canada or what? And tell us, what do you take with you? How does the preparation bag look like?
Yeah, so the hospital I went to, they kind of gave you a checklist. This is what we recommend you bring with. So for me, it was obviously clothes for the newborn. I brought some diapers. I didn't have to, they provided all of that. And, butt cream, all of that, they actually provided for the baby and some for you to take home. So that was good, but I just brought mine in case. Obviously some nightgowns for myself, slippers, some snacks, but they kind of had a menu. You would phone in your order and they'd bring your food 3 meals a day. So I didn't have to worry about that. But, if there's something that you specifically like, you bring it with you. Aftercare, the diapers and everything for the mom, they've got those there for you. You can bring your own if you have a preference, but they've got that there for you and send you home with some of that as well. So it's just, I found in South Africa, like Discovery would send you this box, maybe with like a change pad and some rattles and things like that. But in terms of, the things you essentially need for the baby, they're going to provide it for you in the hospital. So it's more about your comfort after that. So things, comfort wise to bring with you.
Okay, so there's little extras that but they give you a list and tell you this is what you need to bring with, so you know exactly.
Yeah. So, and they had everything like for the mom, for the baby, for the dad, and it was, we have Wi-Fi, so bring your tablet if you want to watch some shows. And, they really made it easy to know what was going to be in your room and what you might want to bring with you. So they're really good about preparing you.
What you expect, exactly. So that's great. Breastfeeding support, is that available in the hospital, or is it something that you need to kind of get privately?
No. So again, I think it might vary by hospital, but the one that I was at, it was, and it's like a sensitive subject for a lot of people, but it was definitely breastfeeding was pushed on you, which, for me, that was fine because that's what I did with the first one and I was fine with it. But if you're planning not to breastfeed, you might find that there's a little bit of a pushback with that because they definitely push breastfeeding here. So if you're not going to breastfeed, you might actually find that is the more difficult thing, is trying to push for bottle feeding.
Okay, well, that's interesting. But I think that was a very similar experience in South Africa as well. Yeah, so I found that thing, yeah. For reasons they are all pro that, and it's the same in South Africa versus Canada.
Yeah, and I think it's just, to mentally prepare yourself, because sometimes your milk doesn't come in or the baby's not latching. You just have to be firm. And, you know, if you get some pushback, it might happen, but just, you know, be firm. But if you need the support, they're pretty good once you make it clear to them what you want.
Oh, cool. Okay. So talking about going now, you've given birth and you're about to be kicked out after the 2 or 3 days, kind of going, there you go on your own. How does it look in terms of your checkups? How regular are the checkups? Do you take them through a doctor? Your injections? Where do you go? Is there a pediatrician? Is there a clinic?
Yeah, so the first thing they ask you is, okay, do you have a GP? Because they know that some people don't. So we didn't have a GP yet at that stage. So the first few checkups, they have a clinic in hospital. So you just bring your baby there. So there's no, you know, panicking that I don't have a GP to take them to. They've got the clinic and they pre-schedule everything for you. Show up on this date, you've got the time. So that was perfect. So, you know, the first few wellness checks for the baby we did at the hospital. Luckily, once we had a newborn, when you tell that to a GP, they said, oh, a newborn, well, we'll take the baby on. So they always take on a newborn baby. And then once you're in there, usually you can get them to take on the family. So it's a good way to get into a GP. So then we just, I actually never took her to the pediatrician after the first few checkups at the hospital. We've just done everything with the GP. So the checkups, the inoculations, everything we've done with the GP. So only if we feel that something is off, then would they send us the pediatrician.
Okay. Okay. So you do get all the help that you would need from that perspective as well.
Yep.
I think another thing is just in terms of looking at doctors and things like that, which I've seen quite a few people do, is it's not always that in South Africa you would have a GP and everybody would go to that one GP and that's where you would make your appointments. I found that some people, what they do here is slightly different. Mom and the kids might be at the GP that's closer to home and dad might be at a GP that's closer to work, just purely because of schedules and stuff like that. It's obviously different now in COVID, but you know what, so it kind of like, you find that sometimes they don't always all have the same thing. And as you've said, if they take on the child, then they will take on the family, you know, so.
Yeah, I mean, I have seen that. And I think when I've seen the family, like one parent and the kids have a different doctor, it's kind of been that maybe that one spouse had the GP before they were married and had kids and they just stayed with them.
Yeah.
So I have seen it, but usually you all kind of stick to one doctor. But I think it's just a case of, you know, I had this GP forever. You guys have that one, that's fine. So you don't have to be at the same one, but it's just usually more convenient.
Yeah, it is. It is. So let's talk about after birth. Okay. Practical things that people ask as well as the car seats. I get that question. Can I bring the car seat, especially when you're on the flight and when you get in the car? Can you bring that car seat over from South Africa? What are the regulations? I know that it's different. So
yeah, so we did, but the standards actually are different. So technically, if you have a car seat in Canada, it has to have a little sticker to say it's been approved by the Canadian standards. So we had a European car seat. And the main thing I noticed, which the difference is on the chest strap, there's just an extra buckle here.
Okay.
And when you do some Googling, I mean, Europe says you don't need it. It's not super safe. It could crack their sternum, whereas Canada and North America say it's fine. So you really are supposed to get a Canadian approved car seat. I did use my European one for the first few months because it was an infant one and I didn't want to buy an infant one for a few months. Okay. And then we had the Canadian one after that. So it's kind of up to you. Technically, you should have a Canadian approved one, but I knew that the standards were actually the same or higher sometimes in Europe. So I just used mine.
Okay, that's interesting.
But if you're trying to resell that on Kijiji or something like that, no one's going to probably buy it.
Yeah, and because they've also got an expiry date on the car seat, so I think it's around about 3 or 5 years, right? That they've got.
Here, I think they said it's either 5 or 10. It's one or the other. So it was actually quite long because some of our neighbors did have car seats that they said we could have, but they had expired, so we just opted to get a new one.
Oh, okay. I remember I had family coming over from South Africa to visit for a few weeks, and I do not have those kind of things available. So I reached out on Facebook and friends and said, hey guys, who's got some? And the experience I've had with that is they they're very easy. You know, the Canadians were just amazing. They said, you know, here you go. Here's a car seat. Here's a pram. Here's everything that you need. And I said, okay, great. I'll have it washed. And they said to me, you know what? It's going to expire once you give it back, it's going to be 3 or 4 months. I'm not going to need it back. Please dispose of it because I can't do anything once, you know, it's like, you know, you can't reuse that. So there are things you don't necessarily have to buy new as well when you come over, because there's many people that kind of pass that over if you want to, just as long as it's within that legal period of buying the stuff.
Yeah, I mean, if you don't know anyone, you usually have to, like, you can go on Facebook Marketplace. Kijiji is sort of our gum tree here. You can find lots of things. You don't have to buy new. Like, we happen to get there's really good sales because of these expiry dates. Like, I found that, what month are we in now? I think it was like July, August, because they come out with the new models in September. Oh, yeah. Like, my car seats were on clearance in the summer. So you could get a new one for almost the same price as a used one. So, you know, just depending on the time of the year, you might get a really good deal. Also, the thing we found here, because Amazon is here, all that stuff you can buy online. It's like, usually, you know, that's your cheapest option. So it also makes shopping for these things so much easier.
Absolutely. And things like the practical stuff, like having a baby and clothing and getting them in and out of, you know, the cars in the winter. What was that experience like? Because, you know, for a South African to take, you know, suddenly you've got a child and you've got snow and you've got to, you know, get through the transport system. How did that work? What was your experience around that?
Yeah, so again, Canada's very equipped for this. So, you know, those sleeping bags that you can zip the baby into?
Oh, yeah, yeah.
So you can get those like winterized ones that are really good. Either you can put it into the car seat so that the baby, you can leave it in there and have them dressed in one layer and then zip them into that for the car seat. Because if you have the car seat that goes onto the stroller, then it's sort of their winter jacket is just always in the car, which is convenient.
Oh, that's great, yeah.
The other one is you get these things that sort of zip into the car seat or the stroller. Same thing, the baby goes in and you zip it up. It's almost like a little sleeping bag that covers them.
Oh, wow.
You don't have to be, you know, you can have them in the home layer. And then when you go to take them out, you just zip them into the car seat. And then that's fine. You don't have to be worrying about getting in and out of the car seat. It just stays in there.
Oh, they make it so easy, as you said. And dressing a baby, how do you know just because, I mean, is it too many layers? You know, the temperatures are very regulated in your house itself. So it's a very even temperature. And then going out, what do you buy? What do you get extra? Some advice on that?
Yeah, so I found that, you know, the normal stuff, that was all, you know, pretty standard. But then I'd get like a little vest to go under it especially for nighttime. So it's, you know, like a little, they sell them here. So it's just like a little sleeping vest that goes under the onesie. That's great for nighttime. And then I just use more of those bags that zipped into the stroller for when I was taking her out. If I was going to take her in the baby carrier, there's baby snowsuits. You just put her in a little baby snowsuit.
And don't they look just too cute in those little they're like straight.
Yeah. Yeah. They're just arms out like this and that's it. Yeah.
Oh, that's great. And so from clothing perspective right through, you can get everything here. You don't have to worry. And you can buy, many of those things are practically new if you buy them from secondhand stores.
Oh my goodness. And online too, people are like, here's a bag of clothes, or, you know, depending where you're staying, like all of my baby clothes now I'm giving to a friend who has 3 people who are all having daughters. So I'm just like, here's bags of clothes. Like, people are always just handing off baby clothes. So that's usually not too big of a concern.
That's cool. You know, it's just a giving community and you can get the stuff, and don't worry too much about that because the kids, you can get all the stuff here, as we said.
And it's so cheap. It's so cheap.
So nappy brands and stuff like that, is it, do you get Pampers like you used to do and Huggies in South Africa? You get all of that. There's no, and formulas of milk. I know I've seen quite a lot of people asking on Facebook groups around, you know, my child's on a different formula there. How do I bring it over? Those kind of things. What can you, from flying, what can you bring over? And also kind of like getting into different brands. Any advice on that?
Yeah, so the nappies, it's the same. You've got all the major brands here. So that's standard. But if you go, some of the stores, like one here is called Superstore. They have what they call No Name. It's like an in-house brand. And those are a lot cheaper because they're not name brand, and they work just as well. So you will find that you get some cheaper options as well. And Costco here sells nappies as well, so you can get them cheaper. And I think, well, Costco, they call it their house brand, but it's actually made by Huggies. So if you like Huggies, it's Costco, that's what they sell. Baby wipes, if you have a Costco membership, you get them by 1,000 per box. So it's great. Yeah, it's a huge box. When it comes to the formula, I found that the brands were different. With my second child, I haven't had to use formula yet, but with my first one, I was using Non, which I think is Nestle. I didn't see that here. So the brands are different. So I think what you need to do is check the one that you're buying, who it's owned by, because the parent companies, they're always going to have the same in both countries, and just see in Canada what that parent company brands it as. Because sometimes it's the same, it's just the packaging and the name are going to be different.
Okay.
But in terms of bringing formula over, it's not like a regulated substance. So, I mean, you could bring as many cans as you wanted to get started. And then you could maybe mix a little bit of that one with the one in Canada to get the baby used to it if there is going to be a taste difference or anything like that.
Yeah, and just kind of ease them into that. But kind of reach out to your doctor if you're really having those kind of problems, so that they can tell you what, you know, is working well.
Yeah, if your baby needs a special formula, then the doctors here will tell you, okay, this one is for this and this is what you need. So they'll be really good about telling you which one is recommended.
Okay, cool. I have to tell you a funny story about you talk about the baby wipes and thousands and things like that. And one of the things I never realized with baby wipes, we've got them, once you've got a kid, whether mine's now 14, so it's many moons ago, but you always carry wet wipes. Once a mom, always a mom, always have wet wipes. And so we always used to carry in South Africa wet wipes in the car because it's just so convenient. And winter came along and they froze. They literally froze the baby wipes inside the car because we kept them in one of the containers. It was solidly frozen. So one morning I was trying to wipe something down and this thing was a solid piece of frozen, you know, kind of like wipes that you could do nothing with. So maybe that's not the best thing. Yeah, it's not the best thing. So talking about first winter with the baby, did you have to do anything specifically? You know, you're kind of heading into, she was born in the winter, so it's very different.
Yeah, I mean, we didn't have snow yet, so the first few months it was more like fall. I mean, it was cooler, so I had to do, you know, bundle her up and everything. But once the snow came, I have a running stroller,
okay.
So to push her around, and that was easy. So those go through the snow just fine. If you're finding your wheels are having problem, they just say put zap straps on them, and it acts like a snow tire on the stroller. So that's one thing I was told. But other than that, I didn't really find much of a difference. Like, it was just, okay, if I was going to take her out in the snow, make sure I was using the running stroller, make sure she was in her little snowsuit or bundled up. You know, there are certain temperatures that they say don't take them out if their face is going to be exposed. So depending where you're living, you might have to think of that.
Yeah.
But other than that, I didn't really find there was a huge difference, because inside the house, everything is heated. If you go out to the stores or the restaurants, which nowadays not so much, but everything is heated. So it's really just between the car and the store, the car and the house, that you're going to feel the colder if you're out for a walk.
Exactly. So I think, for my own unenlightened opinion, is that I think it must be a bit easier having kids in terms of in your house, because the temperature isn't even 23 or whatever you want to put it. So it's just easy for a baby to kind of have that. So you don't have to have inside the house those layers that you used to be in South Africa in the winter when the house is kind of really
in the house, the baby doesn't have to have, you know, layers in their jacket and worried about the blankets and everything. It's a constant temperature. So it's a lot easier for you to know, okay, they're going to be warm enough because this is the temperature of the house.
Exactly. So, and let's talk moms and babies groups after the support. I know, you know, in South Africa, we used to have moms and babes, and there were lots of those. Do you have stuff like that? I've seen some swimming programs at the recreation centers. So each town or each suburb would have many recreation centers, and I've seen they've got some fantastic swimming, you know, from really tiny babies. So what have you experienced on that?
Yeah, so the rec centers, there is one in every community, and each of them has the swimming programs, like you said, so you can take your baby. But they also have the moms and babes classes as well. So from a young age, you take your baby, and it's, you know, you do singing and games with the babies and socialize. So there's those through the rec center, which is quite cheap. or certain, like the library has bring your baby. So it's also like more socializing for the moms, but bring the babies for reading time. You can find online like Facebook groups like, oh, we meet at this park on these days, and you'll see a group of moms out at the park or out for walks. So it's definitely a thing here. You just have to see what's available in your community, but the rec centers always have those kinds of programs if you don't know anybody and you want to, you know, meet some people.
Okay, so it's very much the same as what you would find. You would not be isolated. That's what we're saying. Is you definitely would have the support, and you just need to reach out.
Yeah.
There's definitely some things to do. One of the things that I've heard a question a lot about is childcare is quite expensive in Canada. So take us through. Do you pay for that? How does that work?
Yeah, so depending on your maternity leave, so you know you are allowed legally to take a year, but you're not going to be earning your full salary. So, you know, depending on your own scenario, you're going to put them in daycare at some time, or maybe if you don't work, you don't need to worry about that. But if you have to get a daycare, it is going to be out of pocket. And depending on, number one, where you're based, you might find it's hard to get them a spot in a daycare. Like there's a waiting list.
It's crazy.
When we got here, like I was very concerned about that for my older daughter. But Ontario has a system, it's an online system that you go in and you create an account and you put in the area that you're staying in and the details of your child's age, and it will tell you all the daycares that have programs for their age group. And you pick, I would prefer to have these top 5, maybe based on location.
Okay.
And then they phone you and say, we have a spot or we don't have a spot. Okay. All the ones that I picked, I was very lucky. They all had spots.
Okay.
So then we went around and we looked at, you know, which one we wanted to put her in, and then they would tell you the cost, and then you would make a decision from there. You're probably looking at $900 a month.
Wow.
Minimum.
Yeah, that's the kind of figures I heard as
well. Child.
Yeah, and I think that's still, I know in Toronto, you're going well above that, and BC, I've heard the same thing.
And also because it's harder, like, so in Toronto and Vancouver, it's harder to get a spot because of the population size, and it's going to be above that 900. That's kind of 900 is if you're not in those cities.
Yeah, so it is something that you need to kind of consider when you do that. So you've spoken about you can take up to a year of unemployment. How does the unemployment, or do they call it maternity? What do they call it here? And how's the process of claiming? Is that an automated process? Do you have to stand in a queue? How does that look? And for how long?
So there's different benefits. So when you're pregnant, there's a certain amount of leave you'll get. And then after birth, there's a certain amount of leave that each parent can take. So it also can vary by province, and you have to claim. So it's very in-depth. So it's actually one of the videos we're doing for our FAQ Fridays next week. So I'm actually researching everything because, side note, I'm self-employed. I was not able to claim any of it. I had to work immediately after childbirth. So if you're self-employed, unless you have been paying employment insurance, which is like UIF for a year, you're out of luck. You get nothing. You have to just work.
You're on your own. Gotta do it.
But yeah, I'll be doing the video next Friday because it's quite complicated. There's a certain period that you get before birth. There's a certain period after birth, and then a certain period of that both parents, so dads, can actually also take.
Oh, wow.
And then depending on if it's before and after, you get a certain percentage of your income. So it's a little bit complicated, but there is benefits that you can get for sure.
Oh, great. Okay, so what I'll do is I will add this onto the video, and I'll get a link so the guys that's watching this video would be able to click through to your link for next week and make sure that they can kind of follow exactly how that looks like. So that's going to be
and we'll have the links that they can go and look as well because it's very complicated. They've got really good on the government website examples, and they break it down for you with charts. So we'll have all those links for people to go and do to look at it afterwards as well.
Exactly. I think especially also right now in the time, one of the things that I feel that we have to mention to people coming over is that right now during COVID time, it's very different. Everything, the way that people process whether they should stay at home and consider daycare, and where they used to go into, I know for us living in Toronto, everybody would go into Toronto, where suddenly they're saying there's many people that are going the homeschooling route. There's many moms that said, you know what, I'm going to, for this time, there is just, yes, you can balance it, but some people say we prefer not to. We're going to, one parent's going to stop, and it's not always the mom. That's the great thing. In many instances, it is the dad that kind of stopping because the mom is doing that. So it really varies from situation to situation. And what we are talking about right now, it's a different situation post-COVID, during COVID, and going to be post-COVID. So people would need to work what's for them. You know, and you know, in your case, as you said, you're self-employed, and it's worked from what I've heard, it's worked really well for you guys in terms of having a support system that you've got that in. If you don't have that support system, you're going to need to do what's best for you, but there is help. You know, there is financial help, and the government is putting things in place to be able to support you. The emotional support, I know that they have during COVID, there's a lot of finances that's gone in, funding that's gone in for emotional support for parents and for anybody that's struggling. It is available. So look at your situation, assess it, and here's the one thing, I think the great thing about Canada, it's not only for a specific group of people, that it's available for everyone. So you do not have to do any of this alone. It's tough enough as an immigrant to kind of come to a country and have a baby. You know, even as you said, you're a Canadian citizen, and it was, you know, you kind of had to go through different processes. So don't go through it alone. You don't have to. There are really support groups, and reach out to your South African friends if you just joined to kind of figure out, and reach out to people that's done it, so that they can take you through it. You don't have to do it alone.
Yeah, and when, you know, you're at these doctor's office or the hospital, like, it's just pamphlets everywhere. They've got a group for everything. So, I mean, if you need help, you just phone. Like, there's hotlines, you phone. I mean, if you need to vent, they've got hotlines for that. If you need help making a decision about daycare, like, they literally have assistance for everything. You just have to ask. Yeah. And I mean, like you said, with COVID right now, I mean, they've increased child benefits. The Ontario government has said, if you have a child, we're going to give you $200 each child for what you've had to do to keep them entertained over the summer. Like, they're really trying to make it easy for parents as much as they can. I mean, they can't make everything free, but they really are trying. Yeah. The only thing I would think about right now with COVID and daycare is, if you choose to put them in, because I know a lot of people want to keep them home, but daycares are doing quite a bit in terms of cleaning and social distancing as best they can with young kids. Yeah. But because of the social distancing, the spots are going to be even more limited because they can't take full capacity. So I think, you know, I know a lot of people aren't sending them back. You might luck out and get spots that way, but it's just something to think about, that it might even be harder now to find a spot. I've got a friend, we had our kids at the same time, but she's in Vancouver. She now has to go back to work. She works from home because of COVID. She's got a 1-year-old at home, and her husband is in trade, so he doesn't get to work from home. So now she's got to be working from home by herself with a 1-year-old and doing everything else. So she's a bit panicked. I mean, these are things that everyone is kind of struggling with right now. So it's difficult for everybody, whether you're Canadian or not.
Exactly, yeah. You're going through the process, and as you said, there are help, but yeah, every situation I found is different, and it needs that specific, but you're not alone. Yeah. So on ending on this, the one thing I wanted to just kind of go is, for some people, what is different in terms of words? You will not, you know, what do they call a dummy here in Canada? What is it called? I mean, take us through, please give us some words here.
Yeah, so nappies is, you know, diapers, well, wipes are wipes, butt cream is butt cream. Yeah, don't call it a dummy. So it would be like a soother or a pacifier. Okay. Or some people call it a binky. I don't know where that came from, but I've heard that one a few times. But I found those, I think, were the only ones that there was a huge difference. Onesie is a onesie. A vest, like, I think, yeah, my husband and his mom were calling it, like, they wanted a vest for under the sleeper. Yeah. Here, what did they even call it? Like, I don't think we had a word for it. They were just like, it's a shirt, like, it was just a top. I don't know. They weren't sure what the word vest was. That's not a common thing here.
Yeah, we had with we spoke about sweatbands. You know, what they call sweats as well is one of the things, kind of, which is not a word that we have in South Africa either, in terms of, you know, having that, and things like a jersey. So putting on a child on your jersey.
I don't even use it. Just call it a sweater.
Exactly. So daycare's not going to know what you're talking about, you know. But it's all good, and you'll find your way through it. And you've done it. You've done it. You've got two great kids. We were chatting earlier about just the experiences that children would have that might not be in South Africa, and one of them would be skiing. So don't keep your children when they are of the age. We've seen kids as young as 4 years old that come skiing down and snowboarding down the hill, and they look incredible.
So cute.
And yeah, so take them out and let them experience winter and experience life, because it is fantastic. The kids experience it phenomenally. You know, they just adapt, you know, they get on with it, and they make friends, and it's a great place to have your children.
Oh yeah. I mean, the one big difference we found, you know, my daughter was 2.5 when we came here, and like in South Africa, everything is fenced, everything is gated. It's very hard to know your community. Where we moved now, like, all the kids were out playing basketball, street hockey. And as soon as they saw a new kid move in, everybody was over greeting them and taking her to the playground. And you just find it's a lot more open, because it can be, because you don't have these fences up and everybody is playing outside, and that's the common thing. So it's a lot easier to get to know your neighbors and to make friends a little bit quicker. If we go sit outside, we're always going to see the neighbors at some point in the afternoon. So if you have kids, be outside. You're going to meet the other people with kids too. So it's really social.
Absolutely. And the kids love it, and they love to be around and having you know, that friends around them all the time. You know, the kids driving their bicycles all around from one house to another to another. And you know, as I say, we've also seen dads doing basketball with their kids, and then suddenly the other kids come along, and the next moment you're looking, he's teaching a whole group of kids, you know, playing basketball. And the kids, what I find the best is my kids on the skis and the snowboards, I've said, and the kids doing hockey.
Street hockey. Well, ice or street hockey. Yeah,
or street hockey. The kids just go for it, and they do phenomenally well. You get so proud of your kids, one kind of holding those hockey, you know, sticks, and it's just wonderful, a great experience. So it's definitely a journey, but a journey well worth experiencing.
Yeah, and I mean, I think the main thing is you're always worried about your kids, but they adapt. I mean, there will be a transition period, but they really adapt. And once you see them adjusting here, it's amazing. So you don't have to be, you know, you'll always as a parent be worried for them, but it's very easy for them to adjust and adapt.
Absolutely. I couldn't agree more. It's been great. It's nice. Thank you so much for all the advice and the experiences. It was great to hear that you've had a great experience in South Africa, but you also had a fantastic experience in Canada, and the tips you've given. I think there's loads to be given. And I'm looking forward to sharing the video around what's going to happen in the FAQs next week. Around the benefits, and I'll surely let the guys know from Howzit to tune in to watch that for you guys. It's been fantastic.
Thank you.
Thanks, Deanne.
No problem. Thanks, Mel.
Thank you.